Good morning, everyone. This is Dr. Stephen Aldana. I know, Troy, we've got you on the line. Dr. Troy Adams, the CEO, COO of WellSteps, and we've got Ryan Isaacson working the back phones and working the questions. Troy, were you going to do the introduction today, or am I on my own?
Well, no, I'm really glad that we're all gathered here today. So, how about if I just say that Steve has put a lot of time and effort into preparing this webinar, Wellness Wins a Prevention Lottery, with the ACA, and I know that both of us are over 50 and have lived the prevention lottery, and we're really glad that you've joined us today. I just wanted to remind everybody that phones have been muted to create a nice audio environment for everybody, but you can still participate by submitting your questions via the GoToWebinar chat function, which appears in your GoToWebinar control panel on the right side of your computer screen. We will have time for questions at the end of the webinar, but you can submit them anytime during the webinar. Also on the GoToWebinar control panel, we'll answer those questions that we can during the webinar, but we'll save some of the questions that Steve will answer when we're finished. So with that, there aren't many people in the world who know much more about this prevention stuff than Steve. He and I have gone back and forth a lot on a personal basis over some of these things, and it has been helpful for me and with me and my family, actually. So you're going to learn a lot today. And with that, I want to toss to my business partner, Dr. Stephen Aldana.
Thank you, Troy. Good morning, everybody. It's always a pleasure for us to have the opportunity to share some of our information with you in hopes that you can do your wellness work better and you can be more effective at improving employee health or your own health for that matter. The business of ACA and prevention obviously is a pretty recent change for us. And on a personal note, I've been involved with this for quite a long time, not only with some of the original language that was in the ACA bill, with the beginnings of the Health Promotion First bill, which was with Michael O'Donnell, that we've been promoting for about 5 or 6 years before ACA started to be created. But most of the language that we had in our Health Promotion First bill got included into the ACA. So our attempts to create a bill to get through Congress, to get more prevention, to get more exposure to health promotion and wellness programs was stopped when they rolled most of the language of our bill into the new ACA. That was married with this business of prevention. And let's just start with this very first question here, and that is, why are we here today? You and I, most of us on the phone today, whether we're health promotion professionals, HR professionals, whether we are brokers or academics, be what we are, most of us are in charge and doing two things: improving employee health and or reducing the costs associated with employees. In other words, they're hiring us or using wellness programs to try to reduce employee-related expenses, such as healthcare costs or productivity, absenteeism, presenteeism. You get the idea. So we have two goals that all of us are working towards: improving employee health and reducing employee-related expenses. So what we're going to cover today is understand why these preventative services are part of ACA today, see why these changes are going to have an impact on wellness, learn which services are available to all employees who are subject to the new ACA, understand the difference between grandfathered and non-grandfathered status and why this makes a big difference in making prevention services more available to our employees. And then we're going to focus most of our time on a step-by-step instructions, examples, and case studies on how to help employees and wellness programs benefit from these prevention services. So to me, when I look up and upstream and say, why are we even having this discussion at all? It really revolves around a more emotional, human spirit type of an approach. And that is, we do this because we would perhaps like to spend time with grandkids. Here's a picture of a grandfather and a grandson fishing in a mountain stream. It's about spending quality time with a loved one and spouse or significant other. Maybe it's being able to travel or do things that are important to us. We do wellness for business reasons to improve the bottom line, but we do it to improve health. That enables us, as long as we can throughout our lives, to be of service to others, to maybe give of ourselves, to give of our time, to be in the service in our community. Maybe it's in our church, but somewhere where we find value in sharing our lives with those who have need, those who need extra help. And maybe it's just spending time with loved ones, which is not an option that's tough. It's tougher to do if we don't have good health. This because I want to spend as much time as possible with my granddaughter Luna. And Troy and Ryan, they've all met Luna. This is Luna. She's coming up on 2, but it's the ability to be out and about and spend times with those we care about. And to do this, 1, we have to have good health. 2, we have to be alive. So when we talk about why are we here, yes, there is a business case for the prevention of major chronic diseases. But more importantly, this is the right thing for us to do and our employees to do, to have a long, high-quality life, doing the kinds of things that are important to us. So where does all this start? Well, let me show you in the background of why we even have prevention as an option today. There's a lot of studies that have been published on the impact of preventative type services. Everything from immunizations to screenings to flu shots to seatbelt use, screenings for early detection of cancer, whether it's mammography or colonoscopy or PSA tests, even lung screening for lung cancer. There's even a screening for an aortic aneurysm for those who have previously smoked, abnormal aortic aneurysms. The aorta is the large vessel that goes from your heart down the back of your spine to your legs and extremities. It's the largest artery in our bodies. And with smokers, we know that with time, they can develop aneurysms, breaks, leaks, lesions. That's another screen that we can do. In fact, believe it or not, that's one of the screening services that is now free, a screening for an aortic aneurysm. Well, all of these studies come out, and we've known about a lot of these for a long time. But in the last 50 to 100 years, we have this mountain of data. Well, the challenge is, which of this research on the value of prevention is good, which of it is not, what's the consensus, what do we know, what does the science tell us about the best ways to improve people's health and life by identifying and preventing these things from happening in the first place. So there are major panels that have been convened, and these groups get together every year and they review every published study that comes out on, for example, colonoscopy. And there's more than one way to do a colonoscopy besides an endoscopy. There's a variety of ways they can do it with MRIs, they can do it with a camera you can swallow. There's a variety of ways to do a lot of these things. Which ones are best, which ones work, which ones don't. And then there's some stuff out on the fringes. We've got people who have been promoting cod liver oil as a really good way to prevent cardiovascular disease. Okay, well, what do we know about cod liver oil and what does the science say? So the goal of these professionals, and they're academics, researchers, physicians, is to synthesize all of this mountain of data and come up with some recommendations that people can use, mostly targeted at physicians and primary care providers. But now those of us who work in the wellness world are probably better positioned than anybody to maximize the uses of information, because we communicate health with a lot of people every day, more than physicians do. So all of these recommendations that have been done by these panels are what was used to create the U.S. Preventative Services Task Force. That's the group that has actually done the review. This is their website, and they have taken a hard look at what preventative services work for men, what work for women, what work for children, what doesn't work. And part of their job is to grade all of these preventative services with a grade scale of A, B, C, and D. So if we look at the results of these panels, they identify preventative services as groups, as categories. A, those with a high certainty that the net benefit is substantial. In other words, when people do this preventative service, really good things happen, and we got science to back it up, and we're confident. A B grade is there's a high certainty that the net benefit is moderate. In other words, it works, and it's way better than not doing it at all, but it's not quite as big as an A category for some type of preventative services. C grade is the benefit is relatively small. There is a benefit, but it's really small, and they're having a hard time justifying the wide adoption of that preventive service because maybe the cost is so high and the return on that benefit is so small. And then lastly, no benefit, and these should be discouraged. Now, there's very little lobbying that goes into this. This isn't a congressional panel where you can go and show up if I'm a vendor of mammography services to make sure I get on the list. It's about the science. And since it's about the science, they're fairly liberal in what they can and cannot, look at from the science. It's not supposed to be biased, and we hope most of the science is not, and most of it isn't. But it allows us to grade all of the preventative services into what really, really works, what's recommended, and what's not. So any recommended service, preventative service, that is an A or a B is highly encouraged to physicians, healthcare professionals to be doing. C and D, not so much. So which of these services are now free under the Affordable Care Act? Well, what they did is they went through everything that the Preventative Services Task Force has done. And if it was an A or a B, it got the green light. It was rolled into the Affordable Care Act, and we passed a federal law that said insurance companies will pay for these services with no out-of-pocket expense. The rationale being, these services are so important, we don't want to discourage anybody or create barriers for anybody to not get these services. They're good. However, those preventative services that were small benefit or not much is really known about any benefit, we're not going to fund those. They're not available to the public, and we're not going to pay for them. That doesn't mean you can't do them. If you want to do a mammography, if you wanted to get a breast cancer screening and you wanted to do it with an MRI, you're free to do that, but you're going to have to pay for it. If you want to do a colonoscopy and you want to do it via MRI instead of endoscopy, you're free to do that too. If you wanted to do a lot of things, there's nothing to prevent you from doing that. And physicians can recommend any of these. They're just highly encouraged to do the A and the B, and those are the ones that are now free as part of the Affordable Care Act. And the reason, again, is because we know there's good science to back up these services. We want as many people as possible to get them, so we want to remove any barriers to their use. In other words, make it free, encourage people to do it, and they will do it. For a long, long time, that mammography, that colonoscopy was not free. It's $1,200 or $300 or $200, and those who probably need the services the most are the ones who are not getting them because of the cost barrier. This removes the cost barrier. So there is no reason for anybody in the United States to get these services performed free. Now, the question that everybody wants to ask is, does prevention save money? And when we ask that question, we have to look at how it all works. Take breast cancer, for example. About 12.4%, this is based on National Institutes of Health data last month, 12.4% of women in the US will develop breast cancer sometime in their life. So 1 out of 10 women are going to get it, all right? We know that the cost of treating breast cancer depends on the severity and the stage the cancer is in, but it ranges from $20,000 to $100,000 per cancer patient. Well, if 12.4% of the population is going to get it, and the treatment of this is between $20,000 and $100,000 per patient, right there we already have a problem. Of the 12.4% who get it, some of them are going to die, and they may not even get much treatment. Those usually find out and are symptomatic, will get into treatment late, but they may die. That's a small percentage. That's about 5%. The rest are going to find it either early, or they're going to find it in a later stage when it's more obvious, and they're going to spend between $20,000 and $100,000 per case. Well, the cost for a mammography, the average cost around the country, is between $100 and $200 per each one. So 12% of the population is going to get it. That means 88% of the population is not going to get it, and yet they still have to be screened. So you spend a lot of time and money doing mammographies on people who never get it, again, 9 out of 10 who won't, that money doesn't save you anything because you don't find anything. So the question of, does this thing save money, is a complicated one. And it's a question, it's the wrong question we should be asking. So let me give you a couple of examples to bring this home. First off, not long ago, 1994, there was a study that came out from the Czech Republic. This study was actually funded by Philip Morris. Few of you may have heard about this, but it got buried in the media very, very quickly. The researchers, again, hired by Philip Morris, the tobacco company, tried to determine what was the impact of tobacco use on the entire public system, pension, finances of the Czech Republic. The conclusion of that study was very striking. It says $1,227. That's how much the Czech Republic saves on healthcare, pension, and housing every time a smoker dies. Now let me repeat that. Every time somebody in the Czech Republic dies because of tobacco use, the country as a whole saves $1,200. Now, that's a lot of money in that part of the world at that time. What it basically said at the final was the solvency, the financial solvency of the Czech Republic was available because most people smoked and they died before they started to draw on their pension and health care as part of a public option and a socialized medicine system. The tobacco use itself was making the country financially stable because there was no burden of pensions to pay people who were dead from smoking. So here we have an example where it's on a cost-effective and on a cost-benefit basis. If you want to get down to the real nitty-gritty, it's cheaper to have smokers in your society than it is to not have smokers in your society, because they're not a burden on the system because they die early. They're productive, they're active, they work hard, they provide money into the system until about 55 or 65, at which point in time they die. So you get them full productivity up to the very end of that early life, and then they pass away. So there's no carryover at the back end. It is a great model to save money in federal government. You could take it to the next level. If this is really about cost, if I'm a wellness professional and I'm teaching employees, or I'm trying to help my company save money, if you really, really, really want to save money, don't hire females. They cost more money in terms of healthcare cost, about 30% more. Don't hire adults over about the age of 55 because they're going to use your healthcare system way more than others. Every Friday afternoon, you need to hand out 2 or 3 packages of cigarettes because they're going to have reasonably good health until about the age of 55, at which point in time they're going to get a cancer or heart disease and they're going to pass away, and your pension doesn't have to get paid out. So if you really want to argue the financial case for this, forget prevention, forget stopping the diseases, get a highly productive workforce that dies almost immediately into that, at the end of that productivity period. At this crude example, if you really want to get down to the nuts and bolts of dollar for dollar, that's the best way to do it. We all know, 1, that's unethical. 2, it's just morally apprehensible to even think in those terms. And yet that is sometimes the argument that is brought up with this. Another glaring example of this is your ROI on your cavity prevention. Okay, here's the way this works. A dentist calls you up, time for your annual or biannual screening. He's going to do a ceilings and he's going to probe around. He's going to give you a fluoride treatment. And it's going to cost you $150. And you're going to do that every 6 months for 70 years. We'll add it all up. If you add up the cost of all the preventative screenings, of all the preventative services, from all the dentists, for all the teeth you've seen your whole life, that amount is way, 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 way more than if you just let your patient's teeth rot out and then you give them dentures at 35. In other words, don't floss, don't brush, don't clean your teeth, don't do any of that. It's cheaper for you to have your teeth rot and get pulled and get a permanent set of dentures than it is to continually maintain and prevent conditions for those teeth going forward. On a dollar for dollar basis, it's cheaper to let them rot. But we don't think that way, and it's ridiculous to think that way. We want to balance this out with the benefits that are available. So now we get to this argument of cost effectiveness versus cost benefit. And there's a difference. Cost effectiveness is, what does it cost to get a certain effect, benefit? What's the cost per benefit for some change in people's health? Versus cost benefit is strictly a dollar for dollar. How much did it cost? How much did we save analysis? The cost effectiveness analysis for like the seasonal flu vaccination, here's the equation. It's a ratio. So on the top of this, we have, what are all of the costs associated for people who have received a vaccination versus subtracting out all of the costs of the people who have had no vaccination. So the cost in this particular case could be, how many days absent were they at work? What was their difference in their healthcare costs? Did they have, I don't know, they probably wouldn't have a workers' comp claim, but it could turn into a disability claim if they develop pneumonia long term. Are they less productive at work? Do they have more presenteeism, which is usually what we see with flu? What's the cost difference between people who got vaccinated and those who didn't? Divided by this thing called a QAYL, a quality adjusted life year. That's a lot of words. It's years of good health. So how many years of good health do people get who have been vaccinated? Subtracted out the number of years of good health they get for those who are not vaccinated. And what you get is an actual dollar amount per years of healthy life. And for flu vaccinations, and if you look at the research that's been published, it's actually $18,000 per year of really good health gained. That's the cost. So remember, I got my flu shot yesterday, by the way. October is the time I do it. I want to beat the rush, and I also want to get those early people who are getting flus in October, November. And I want those people. And I've been getting flu shots for years, and I'm a happy camper with that. So in that particular case, I hopefully avoided the flu. Maybe I wouldn't have got it anyway, but most years I was getting it. So for me, that flu shot is great because it's 3 days of my life plus a lot of agony. But there are some people who get a flu shot who never would have gotten it in the first place. Well, that's why this cost is where it's at. So this is a cost benefit, a cost effectiveness analysis. Cost benefit is a little bit different. Here's the cost benefit of flu vaccination. What's the cost of the serum? What's the cost of the staff to do it? What's the cost of people having to drive over there to get the shot? What's the total cost of doing this vaccination versus how much money do we save because of it in reduced healthcare costs, absenteeism, presenteeism? And I've reviewed the literature on this, and the results are kind of mixed. Some of the studies have shown a true cost benefit when looking at things like presenteeism and absenteeism. Others have said, no, it actually costs more money than it saves. So the research is a bit of a mixture on that one. Well, my idea with this and how it ties into prevention is I think we're asking the wrong question. What's the cost benefit of prevention is the wrong question. The real question is, what's the value of human life? What's the value of quality life? What is that worth to you? Now, some people, we can argue back and forth about what that really means, and different parts of the world have different values on human life. And we hear people who were, somebody was killed because somebody stole their iPod. Well, the value of life was the value of the iPod. But in terms of, having a civil society where we all get along and treat each other kindly, we do have to draw some limits. For example, we could do lung cancer screening on all smokers with an MRI. We're not going to find very many because it comes quickly and you have to catch them right at the right window. And that MRI is very expensive. So from a cost benefit and a cost effectiveness ratio, it's not very effective. But we could do an X-ray. Then we have this idea of executive physicals where we really want a super duper physical for people. Well, we do that for executives. Why? Because it's expensive and it's not for everybody. It's a bit of a perk. We don't think that is appropriate for everybody because there's a limit as to how much we can really be spending for everybody. So we do have to draw some lines. Colorectal screening, if you offered 4 million people were offered to do colorectal screening who are above age 50, 31,000 deaths would be prevented. 338,000 years of life, of healthy life, would be gained. And that ends up being $11,900 per year of life gained. So how much is your life worth? If I said you're going to die unless you pay $1,200 a year, would you be willing to do that? That's what this question really is all about. It's about quality of life. And that's why we have the Preventative Services Task Force to help us sort all this out. All right, let's get on to the good stuff now. Which preventative services are free? We talked about that. They're the A and the B group. And here's the website that shows you which ones are available. And by the way, for those of you who are wondering, all of the slides and all of the handouts today are going to be posted at the webinars link at wellsteps.com. In fact, just to make sure you can all find it, here's the WellSteps webpage, wellsteps.com. Click on the webinars link right there. On the webinars link, we have next month's webinar. But here's this first one, Wellness Wins the Prevention Lottery. Here's the slides, the recording. We have some posters we're going to be doing, verification forms and billing codes. All the information is there. So you all know how to get it and how to use it. All right. Which preventative services are free? Well, for adults, blood pressure screening, cholesterol screening for age-appropriate people, colorectal screening, depression screening, type 2 diabetes screening, diet counseling, HIV. Here's your abdominal aortic aneurysm. We talked about that one. Alcohol misuse. The doctor thinks you should be on a small dose of aspirin every day. Well, guess what? The aspirin is free. These are the kinds of things that the Affordable Care Act, through the Preventative Services Task Force, has said these things should have no barriers. We should do everything possible to help people receive these types of things. There's more screenings for adults. Obesity screening. There's STD counseling and screening. There's tobacco use screening for all adults and cessation intervention for tobacco users. There's programs that are free that are available to help smokers quit. There's also immunizations that are free. I got mine yesterday. I got my influenza shot yesterday, and I gave him my insurance card, and my bill was $0. Why? Because pneumonia and meningococcal and measles and mumps and rubella and diphtheria, they're all free. You walk in, you give them your card, your insurance card, and it's free. Why? Because we know it saves lives, and we have ability to do that. We've got covered services for women. We've got genetic testing with BRCA1 and BRCA2 genetic counseling for breast cancer. We've got mammography screenings every 1 to 2 years for women over 40, osteoporosis screening, cervical cancer screening, contraception, whether it's the pill or IUD or whatever they are, they're free. They're included. And you could say, well, if contraception is included, are we preventing childbirth? Well, that's what contraception is for. On a cost basis, it is an effective way of reducing costs, especially if we have infants that are born prematurely. And this is that one item in here that has tripped up a lot of people who are concerned that they don't want to be able to provide contraception for religious reasons to their people. And you'll have to work that out with your insurance company and your broker. There are some exceptions that are made for that rule. There's STD screenings. There's personal violence screening and counseling, domestic violence. This is kind of like, I'll talk about it earlier. There's a variety of services that are available now for expecting mothers. Support for breastfeeding. There's even supplies to breastfeeding material and breastfeeding supplies. Urinary tract infection, folic acid supplements are free, gestational diabetes screening. And then there's a whole list of preventative services for children, which up to this point in time were not free. Now they're free. You can't send your kid to a public school unless you have documentation that you've done your preventative screenings or immunizations. Oh, and by the way, they're going to cost you. No, we remove that barrier, make it free. People will do those screenings. In some way, the Affordable Care Act meets employee assistance programs because mental health and depression screening is available now. Alcohol use and abuse and violence counseling. So we've kind of got a melding together of services that are available to do this. Well, all of this will go nowhere if your program is not ungrandfathered. And just let me explain. September 23, 2010, September 23, 2010, it is when this law came into effect. Even though there was Supreme Court rulings and all the other stuff going on, the preventative services piece started 3 years ago. At that point in time, you could have gone to your insurance carrier and said, I would like to do a colonoscopy. And I want to make sure that I get it paid for because of the new federal law. Well, the new federal law says it depends on whether or not your insurance status is grandfathered. If it's an older one from before September 23, 2010, under the old rules, or is it ungrandfathered under the new rules? So for me, grandfathered status is me and my wife and little Luna on the left. I'm grandfathered because I have a grandchild, versus ungrandfathered status on the right. Well, I'm not a grandfather anymore. These services began September 2010. So the question is, how do you become ungrandfathered? How do you get to where these services are now paid for? Well, this is where it gets a little bit complicated. Every single insurance company, by law, whether you're self-funded and you kind of call yourself an insurance company, or you're paying premiums to an insurance company, have to abide by this law. For most of us, it does not have an effect if your policy hasn't had many changes or is older than 2010. So January of 2011, I called my insurance company and said, I'm ready for my free preventative services. And they said, sorry, you can't have those because your policy has been grandfathered. So I said, how do I get ungrandfathered? He says, well, even though you have an insurance policy with us and you're good to go, you've been paying your premiums, you have to reapply. I went, really? So you already have all my information. I've already been through your screening. You've already taken my blood. You've given me a policy. And now for me to get these preventative services, I have to reapply to get another policy so that I can comply with the ACA regulations. She says, that's correct. So we had things scheduled in our home. We had colonoscopy scheduled, mammography scheduled, flu vaccination scheduled. We have all these things we were wanting to do, and why not use them for free if they were free? So yes, I had to reapply. Yes, they came and drew my blood again. Yes, I filled out all the forms and I submitted them, and like 3 months later, they said, you've been approved. I half expected, because of the new preventative services, that my premium was going to skyrocket. It actually went down $100. But I was probably the first person on the planet to call my insurance company to request my federal rights because of the new federal law. Well, it worked. And we have since saved, I did some math, about $6,000 since 2010 in free preventative services that would have not been covered under my old policy. So I had to go and ungrandfather myself. If you wait long enough, every single person on the webinar today, your insurance plan is going to eventually become ungrandfathered. Everyone is going to eventually lose their grandfather status. And the reason is you will automatically lose your grandfathered status if you cut benefits or features than your current plan, if you raise your co-insurance by 20% or more, if you raise your copay by more than about $5, if you raise your deductible by more than about 20%, if you reduce the amount that your employer is contributing, or if you change insurance companies. Well, that pretty much counts every single person in the US. Is going to experience one of those at some point in time. When you do, you flip a switch that you become ungrandfathered. You're now part of the official Affordable Care Act rules with your insurance company, and all of your preventative services are free at that point. So wait long enough, and you're going to change insurance companies, or you're going to reduce your employer contribution, or you're going to make some tweak to your plan. And when you make a tweak to this limit, you lose ungrandfathered status. Now, I know some groups, they're going to cling to their grandfather status as long as they possibly can because they have whatever, political reasons or whatever their reasons are. They're going to resist and fight as long as they can. The Affordable Care Act is here whether you like it or not. And whether you like it or not, you are going to lose your grandfathered status eventually. For me and my family, it's a huge blessing. I'm $6,000 up from where I was since before it all started. So there are reasons to do this besides just prevention. So how does all of this work within your work site? How can you actually make all of this new information available to your employees in a way that will improve employee health and lower healthcare costs. Well, you've all seen, if you've ever been on our WellSteps webinars, you've seen our WellSteps model. And it's not our model per se. It comes from the RE-AIM framework, but it's two things. It's reach, touch as many people as possible, times the impact. The impact is what you're doing to your people. That impact really comes from the scientific term effect size. Effect size is the difference in the effect between the treatment and the intervention group, the treatment and the control group. In other words, you did something to your people. What was the effect? The larger the effect, the more powerful it is. The smaller the effect, nothing happens. So I always use the example of a health risk appraisal. We did a health risk appraisal. We required it of everybody. Everybody took the health risk appraisal. We got great reach. But ask yourself this question: what is the impact on behavior of the people who complete a health risk appraisal? And any of you who have done a health risk appraisal know it doesn't do a lot to change behaviors. It's good for awareness, but people don't suddenly start eating better because they scored something on a health risk appraisal. The effect is actually very, very small. So we don't have an overall effect. We have to do other stuff to get people to change. Well, in this particular case, it's not about changing specific behaviors like we normally think of at WellSteps. It's about the effect size, and that has all been determined by the Preventative Services Task Force. The impact is the impact of the preventive services themselves. So reach, touching as many employees as possible with the age and gender appropriate preventive services, which we know through the reviews of the task force, the A and B category researches, prevention services, we know will have an impact. They wouldn't be on the list, and they wouldn't be for free if we were not positive that they have a big impact. So within your wellness organizations and the things you're doing, this same model works. The impact, the intervention, if you will, is the preventive service itself, times as many people as you can possibly get to do this. If one of your male employees over 50 gets his colonoscopy, that's great for that one, but it's going to do nothing to improve the overall health of the employees of your organization or have any dent on costs within your organization. So this is where we get into the communications. How do you get people to do their preventative services? Well, you've got to start communicating effectively. We have several webinars where we've talked about effectively communicating with people with the right messaging, with a call to action, demonstrating or offering something of value. So we use payroll stuffers and magazines, newsletters and books and email notifications. We do stuff. And in our efforts, we're all very well-meaning, we sometimes fail to get the right messages out at the right place at the right time. We do things like, watch out for testicular cancer, like that's really going to motivate people to get excited about this, or time for your painful mammography. That's a real zinger. Line up for flu shots, because we all want you to get flu shots. That's a tough one. Got the sugar? That's the one I hear in the deep south for people who are type 2 diabetic or hyperglycemic. Got the sugar? You and your abdominal aortic aneurysm. There's another winner. Depressed, because we can do depressed screening. People don't respond. Sexually transmitted diseases are bad. So you're communicating this message, remember, reach, touching as many people as possible, encouraging as many people as possible to do this requires some creativity. So with the help of Amanda Christensen, one of our WellSteps guides, we've kind of been searching the web and searching our files for some innovative and effective communication messages, images that people have been using in the past to communicate the importance of this to their employees. So I'm just going to show you a few of these. All of these have been bookmarked at the WellSteps website under the webinars link, and you can find the actual images here, but I like some of these. Get your rear in here. We need to take a look. This is a colonoscopy ad to convince people to come do their colonoscopy. You had the birds and the bees talk with your teenager. This is just a colonoscopy. This is way easier than having that conversation with your kids. You changed a flat in your Sunday suit. This is a lot easier. This is just a colonoscopy. And you know, when you turn 50, you know, you're probably supposed to get it. I'm not 50. I'm 49 and 13 months. So, you know what? No more excuses. It's going to save your life. Just get in here and do this. It's pretty easy to do. This is one that's on the Metro up in Washington, D.C. It says, insert butt joke here. Important fact about colon cancer screening here. You get the idea. You can put any kind of butt joke you want on there and people will come. There's breast cancer screening messages. You know, it's time. Schedule your annual mammogram. That's what we want you to do. So people have created some good messaging, trying to reach people through different means, such as the fact that husbands need wives to get mammograms. If you don't want to do it for yourself, do it for your husband. If you don't want to do it for your husband, do it for your son. You know, there are compelling reasons, and we can have some fun with this. Mammograms are healthy too. A little joke on mammograms from the orange in the refrigerator. Here's a pretty good one. A mammogram can detect breast cancer that's still this small. And then on the bottom, they show you the size of the lump that's found accidentally and the size of the lump that's found with the breast exam. So finding it really small makes a big difference. We got colonoscopy messaging, we've got breast cancer messaging, we've got flu vaccination messaging. Like this guy, germs out in a second, around for hours, and they're available. And don't we wish people could wear signs? I've got the flu, stay away from me. But we don't. We walk around and we get it. Expecting mothers and new mothers know they want kids to be protected. So not vaccinated, no kisses. Stay away from me unless you're clean. You know, spread the music, not the flu. You know, and get your flu shot. It's amazing what the flu shot does. This is one of my favorites right here. Who needs a flu vaccination? A, U, B, U, C, U, D, all of the above. And we get it and we feel good. Here's one for infant and childhood immunizations. This girl's pretty cute. Think she's protected? No, because she's not been vaccinated. She got everything she needs to keep herself good to go, but she's not protected. So all of these posters and the direct links to the sites for these posters, Troy has put together a website, wellsteps.com/posters. You can get these ideas. You can create your own. You can take some of the images. You can create some things on your own. You've got to have a compelling message. The message should include spouses. We want to reach out to spouses. They are fonts of moral support and encouragement. And if we can get to a spouse, sometimes we can get to an employee that we wouldn't otherwise be able to get to. And it applies to both, because typically both the employee and a spouse and or significant other are on your health plan. You're paying for them, especially through healthcare costs. So you might as well make these available to them also. And they're free. All right. Some examples of how you can actually implement these programs in the real world. And we have spent an awful lot of time at WellSteps thinking about ways to meaningfully do this. There has been some research that has looked at the impact of SMS, text messaging, short messages, reminders, if you will, emails to people that are carefully crafted. And some of that research has shown that when people who get reminders are 33% more likely to be compliant with the screening. So we've been trying to read the research and what's in this. So we created the screening reminder, which was actually pretty simple to do, and it's a fabulous tool. You can do the same. I have known a few insurance carriers who have a similar type of functionality. But basically, when people sign up for WellSteps, they first register. We get some very simple health risk appraisal information, personal health assessment data right up front. So I know your age, I know because I know your birth date, I know your gender, and you indicate what your gender is. Typically, we already have an email address. And for those that want reminders, you just have to put in your mobile phone number. So we have your mobile phone. With that, we have developed this programming that automatically sends out reminders at the correct age and gender appropriate times. So around your 50th birthday, you're going to get a reminder and a great little message about the benefits that come to people when they get a colonoscopy. So these are simple reminders to help you get this into your. We can even send it to spouses and significant others to remind you to do this. We have another one. It's called the Know Your Numbers campaign. This campaign is really about encouraging people to get their biometric screening completed. Most of it depends on whether or not people want to have a screener come in and do their screening, or if they want to just encourage people to go out and get it. Well, with the changes with the Affordable Care Act, the screening for blood pressure and cholesterol, and in some cases diabetes, is free. So what used to be a barrier for employees to participate in a Know Your Numbers campaign is no longer a barrier, because they can go to the Know Your Numbers campaign, they can go to the program center, they can watch a short video about screening in week 1 or week 2, get screened, see their data, see how their life will be changed, and the screening is now free because of the Affordable Care Act that's available. So companies can now use this information within behavior change campaigns to get as many people as possible to engage in the screening. Now, we've been doing this for quite a while, and we have had some spectacular successes and some unfortunate failures. And we have learned as we've gone along the way. But some of the reasons these programs fail are because they're not communicated properly. Again, we tend to fall back to our old health education models, where we sometimes use fear to get people to do things. Sometimes we offer and encourage people to do screenings, but there's no incentive. And at that point in time, there was a cost involved. So talk about a double whammy. Not only is there not an incentive for you, but it's going to cost you money to do this. So we just never got the uptake we wanted. One problem is billing. And this problem is still there today because the law is so new and so many people don't know what they're doing. When you go to do your preventative service, they're going to bill it as a mammography, and they're going to bill your insurance company, and you're going to pay for it because they don't know the correct billing codes. So what we found was, if we're going to do a preventative screenings campaign, encourage our people through incentives to do it, we also have to give them the billing codes. We send this piece of paper along with you. I've posted this on our website. Here are the CPT codes and the billing codes that your carrier is going to need, or your doctor is going to need, to make sure they bill it so that it's free. And if without the codes, you're going to show up to do your mammography and they're going to put it in some other category, and you're going to be stuck because they may not be up to speed yet, or they may have misunderstood. Well, I would just like to do an osteoporosis screening. They'll go, okay, wait, I'm over 65 and I can get it for free if you do it right. Or I want to do a prostate screening. Okay, here's your insurance card, and they bill for it. They're going to bill for it, but the insurance company needs to know which ones of these are free and which ones are not. And here's the codes, the secret codes, to get them billed correctly. So, a few more questions to wrap up here. What's the impact on self-insured versus fully insured groups who are now part of ACA? If you've been ungrandfathered, by law, these are free. If I'm fully insured, if I'm paying premiums to XYZ insurance company, they are required by law to pay for these services for free. My example of having to reapply for insurance through my carrier to get ungrandfathered is an example of how they're not too excited about doing this. Now, I think some of them are very, very good, but some insurance companies don't want to do anything for free. They're going to want to bill you for it. So there may be some smoke and mirrors, and there may be some hesitancy on part of your carriers to do this. And they may bill it under the wrong code, thinking you won't notice. We've given you the codes. They're responsible by law to do it. You need to tell them up front, this is part of my free preventative screenings, preventative services. All right, Dr. Aldana, I work for a company and we're fully insured. In other words, we're doing our own claims. We're paying for our own insurance. We now have to pay for this expense. I hear you, and it is an expense that you're going to have to pay for. However, what's the value of your employee's life and health? That's the question. What's the value to this in terms of reduced presenteeism, absenteeism, greater productivity, recruitment, retention, morale, and saving that one employee's life who's a vital employee, that one colon cancer patient or that one breast cancer patient that you found early? What's the value in that to you? Because there's not a positive ROI on this. You're going to lose money on this. If you really are all about money, don't hire females. Hire people until they're 55, let them go, fire them, and hand out cigarettes every Friday afternoon. And some vodka. Why not go for the vodka? That's how you solve that ROI problem, if that's what you really want to do. Now, I know you're not going there. Well, you can tie your preventative screenings to incentives. And this is the best way to start motivating people to do this. We use this form right here. I've included this on the Well Steps webinars page. It's a simple form that says, Dave, Bob, Mary, here's your age appropriate screenings. Here's a little note. Take this to your doctor and say, yes, no, to my knowledge, Troy or X person or whoever it is current with their age and gender-based preventative screenings, and they sign it, which is now proof that you're up to date on all your preventative screenings, which were free. This can be turned back into your wellness counselor or your wellness professional or whoever you want to do. WellSteps gets this. And see that barcode? That barcode's really easy to do. It's the barcode font. You can change anything to a barcode font. That's the employee ID number. So as these come back in the mail, or they get faxed back to us, or they're sent back to us, all we do is take our little scanner and go ding, and it's in, and automatically we know through our reward center who has completed this task and who has not. And it's tied to a benefits plan, a premium reduction, or a different plan design change. So we use this little form. It's at wellsteps.com, the webinars link, to hand out as part of one of our incentives. If you will do this, good things in terms of incentive will happen. Take the form to your doctor, have him sign it, bring it back, you get whatever you're going to get. Now we're really going to put some teeth in this preventative services, and it's free for the employee. So we use this a lot. And the barcode makes it crazy easy to track. Or they can even put it on here and click off they've done it themselves, and then we can verify whether or not they've completed that activity with our rewards tracker. Then they get their discount or their premium, or they get their gift card, or whatever it is that you have offered as an incentive. All right, why are we here? Well, preventative measures prevent suffering, disease, and death. That's why we do it. It's about health, and most of us have been hired as vendors or wellness professionals, brokers, to improve the health of the people we serve. Prevention is now free for every single American. Welcome to Canada. They've been doing this for 50 years. We finally got it down here. Wellness programs can use this change to improve employee health, to save lives, to reduce some employee-related expenses, not all of them. So I'm going to turn it back over to Troy and Ryan, who've been working the back ends and your phone. I will say that next month, we're going to review a webinar we did a couple years ago. OMG, your HRA is MIA. Your health risk appraisal is missing in action. You're not getting out of it what you should. This is the second time we've done this. It's been a while. We've had a lot of requests. We thought we would bring it back out again. That's December the 5th. Troy, Ryan, how are we doing?
We're doing great, Steve. A lot of good responses to the webinar so far. Some very, very deep, heady questions. People are really, really thinking about this. Here's one from a question from Deborah. She says, do you think there will be an incentive for employers to continue to provide private insurance versus paying what I understand is a less expensive ACA penalty? If not, what is the future of employer-sponsored wellness programs?
We thought about that question about 5 years ago, didn't we, Troy?
Yes, we did.
When they started to have this discussion. When you consider the tax ramifications of paying, remember, right now when companies pay for your health care, that's a tax deductible expense for a company. So there's a tax benefit there. When you calculate that with the penalty that they have to pay, which is currently a couple $1,000s per employee per year, some would say it's a bit of a wash. Some would say it's not. I'm of the opinion, and that's just me. A lot of brokers on the phone today, a lot of others will disagree. I'm of the opinion that once the system is up and running, I think we're going to see a departure of employer-sponsored health plans, where you're just going to be on your own individual market, out in the market by yourself getting insurance, because quite frankly, it's just a headache. It's a big expense, and I think some employers, and I think that number is going to grow, will find it much easier and much more pleasant. Just take health care off the table and say, here's my $2,000 penalty. Go to the exchanges and we're on our way, and we don't do health care anymore. That's on your own. I see that as the future. I do. And a lot of people will disagree with me on that, but I see it as the way where all this is going. What does that mean for wellness programs? Well, that's the first time in American history where our American system starts to look like Canada or Brazil or France or the Netherlands or Japan or every other country in the world that has some form of public or socialized model. Employers are doing wellness everywhere around the world, except in the US. They're doing it for all the reasons except healthcare costs. So in April, I'll be in Montreal talking about wellness with 500 employers and HR people. Why? Because they're worried about productivity, presenteeism, not healthcare costs, workers' comp, all of the reasons for doing wellness except healthcare. So they're already at where we are headed, and they're more than excited about wellness. So I don't see wellness changing that much, but I do see employers bumping into the exchanges.
It's a great response. This is sort of a follow-up to that. This is an interesting question. Somebody asked, how will this change impact wellness vendors, since many wellness vendors provide screening, and the screenings will now be free?
Now, don't misunderstand me. The screenings for healthcare providers are not free. If I'm a radiologist, if I'm the county health department and I'm doing immunizations, all the providers of these services are getting paid. It's just that the insurance company is going to have to reimburse them out of their expenses in providing typical care at no additional cost. The whole is everybody gets paid. None of the money can come from the person getting screened, but they're getting paid. It's not like you're going to get paid. You get paid. It's a billable event. That's what those codes are for. But it's not coming out of individuals' pockets. It's everybody except the individuals. Now, you could say, yes, it's individuals because they're all going to pay premiums and those premiums are going up. That's probably going to have some effect on it. My premiums went down $100, so bring it on.
Here's a great question from Christy related to that. She says, so the prevention screening is free, but what about co-pays for the actual office visit? What's been your experience with that, Steve?
No copay, no deductible, no out of pocket, zero. There is no out of pocket expense of any kind for any of these preventative services. Zero. Make sure you tell your people that also. That's a good point. I didn't bring that up. No personal money involved.
Yeah, no, Christy, just to add to that, I went in for an annual physical here recently, and Steve and I had been talking about this, and I know that Steve was preparing this webinar, and I said, what we really need is we need some way to educate people about the billing codes, because you go in for this free preventive screening. It's an annual physical. It's supposed to be free. And the people who are doing the billing, they've been providing the same billing codes for 20 or 30 years. They're going to bill your insurance company, and you're still going to get a bill from your insurance company. And probably 99% of the people are going to say, oh, it's a bill. I'll just pay this bill. Well, because Steve and I had been talking about this, I went in for the screening. Sure enough, I got a bill. And I said, wait a minute, I shouldn't be paying this. And so I actually called my doctor's office back, and I said, you need to rebill this to the insurance company and use these billing codes. And we provided a document at the webinars link that includes some of these preventive services and the corresponding billing codes. It's a one-page PDF. We've integrated it with our screening reminder so that people will have that at their disposal when they go to get these services. They'll know how to educate the medical billers how to bill. So that's just a little add-on. Here, you kind of related to this, Steve. This is free. These are free services, but somebody's got to pay, and it's either the health insurance companies or it's the employer, depending on what kind of plan they have. This person said the health insurance companies do not always make it easy. Reimbursement may take a bit of a fight. This is with respect to breast cancer, or not breastfeeding supplies. They might put limits on where you get supplies from. Can you comment on that?
Yeah, they've come screaming and kicking to the table on this one. All of them, with the exception of those carriers that have integrated models. That means they're both providing healthcare and they're providing insurance, like Kaiser Permanente. Kaiser Permanente is an integrated model. They not only do they insure you, but they provide the health care. And since they're the insurance company, they save money when they prevent the diseases. They promote prevention like crazy, more than any other carriers, because they stand to gain from it, from the services. Just the insurance companies alone, they have, it's the law. And yes, they're going to have some fight and they're going to put up some struggles, but that's why we've given you the codes. That's why we've given you, the information on the law. Some are going to fight it completely. You just refile it, call your healthcare provider, rebill it, resubmit it. It's the law. That's the way it is. If they don't, they're breaking the law.
Um, here's a comment from Gerard. He says even if the preventive screening for colonoscopy is free, if they find a polyp, they now will charge you for removing it. So
That is correct. And that is a different billable event. But once they get in and find that, that's a much smaller expense than it was originally. And isn't that why you do it in the first place? I mean, don't we? It's like I did a breast cancer screening that was free and they found breast cancer. And now I'm disappointed that I went in and did my screening. I don't, you got cancer. That's why you have insurance. That's why it's in there. It's there to save your life and to improve the quality of your life. And God bless them if they can find things early.
we really have time for one more question, Steve. This one's from Susan. Question is, are the preventive services free to anyone, or are they only free if you're covered by a health plan, either employer or government?
Doesn't matter as long as your insurance company plan, whatever it is ungrandfathered. If it's an old one and it hasn't changed in 20 years and they're not going to move over to Obamacare, you have nothing. It does not apply to you until your plan has become ungrandfathered. That's the hinge in all of this. And most plans are, all the plans, if you get insurance in the exchanges, all of those are. If you have a current plan, you can reapply. You can talk to them and say, I want to be ungrandfathered. I want to be on my way. It might take 5 years or 10 years. Every plan is going to be ungrandfathered eventually, but you might have to hasten that process a little bit by start asking for it. Or you can, again, if they make a single change in any direction, they lose their grandfathered status. So it's still working it out. But for everybody who's in the individual market, for small businesses, for those that have their own individual plan who are ready to go and grab hold of the Affordable Care Act prevention services, it's a freebie. It's now on the books for all of them.
All right. It looks like we have run out of time. We want to personally thank each and every one of you for taking the time out of your busy schedule to attend this